Hey guys, it's been about 10 days post-op now. My voice is still a little higher than typical range for some reason. Maybe it's because I didn't speak so much when I was in the hospital. Um, and there's a few things I want to talk about, just kind of an update on my status and plus some things I've discovered. So updates on my status. I still feel I need more recovery for sure. It's only been 10 days, so obviously I need more recovery. But my whole abdomen feels good, better, but it doesn't feel normal, and it's not healing as fast as I think it should. But anyways, quick update on what it looks like. Big bruise here on this upper one. This one still bleeds quite a bit. This is also where my hernia repair was, and it'll ooze. It's never fresh blood, it's always old blood. But it oozes quite a bit. I have to change this about twice, 3 times a day. This one over here doesn't ooze as much as it did. And it's weird because it has the most blood, but probably because it's all down here. And it looks terrible. Let me come at you from the side. So yeah, it looks terrible. Doesn't hardly bleed as much as the other. Some of the things I've noticed. Over here on this side where this was done, and this was the other trocar, all of these muscles in here hurt really bad. And it's really, whenever I twist or move, anything that activates that side, I can feel it and it's painful. And it's still better though. Like I can get out of bed without having to use an assisted setup procedure. I don't have to get out of bed slowly. I can just curl up out of bed. So it's definitely getting better. But it still hurts. It's still not perfect. It's going to be probably like that for a while. I'm down to 22 pounds down. My heaviest weight ever before surgery was 340 pounds. And my starting weight at surgery was 305 pounds. And my current weight is 283. So I've lost about 22 pounds. Which is really cool. Happy with that. I'm not as focused on the weight loss though. I mean, you would think that that's all I should be focused on, but it's not. It's my recovery that I'm more focused on than weight loss at this point. Not drinking enough fluids a day. I'm getting about 48 ounces, maybe 50 ounces of pure water, and I'm also not eating enough. I'm doing 3 meals, and they're 3 liquid meals, like 4 ounces of liquid or a 5-ounce yogurt, but definitely not enough. I'm nowhere near hitting the protein mark that my surgeon wants, but I got to focus on the water. I'm noticing, speaking of water, something I've noticed I wanted to say. My skin, all of it, every bit of the skin, it's harder to tell with this camera, but in person, like in the mirror, I can see it. I notice it. It's getting, like I look younger. Like it's more puffy with, it's hydrated. I'm better hydrated, I think, than before I started the diet. My pee is still not clear, but it's straw colored. It's not clear yet, but I think that I look younger. Actually, I think that my wrinkles show up less frequent. I had quit caffeine a long time prior to the surgery. Not a long time, but about a month or 2 prior. But that makes a difference too. Caffeine inhibits your body's healing processes. So I think that I look younger, honestly. And typically the person that it's happening to doesn't see it as fast, but I see it, and so does my girlfriend, and so does my son. New haircut, by the way. Gonna let this side grow out. I don't like doing the shave thing no more. But anyways, I think that I'm doing well. I could be doing better, could be doing worse. I'm still in pain, and I take my pain medicine about twice a day rather than every 4 hours now. So I'm still taking the pain medicine. I've still got my patch for multivitamins. I ordered more. Product code PMD40, patch MD40. So I think that's all I got to report. Today's my son's birthday. We're going to go out to eat. I'm taking him out to eat, and I'm just probably going to have lemon water. And I don't even care. Like my desire for food, I have no desire for food. So there's some stuff, there's some updates. Oh, and I've been trying to take care. You can see where these spots got really torn up from moving bandages around. So you got to be careful. You got to find a way to Maybe put baby powder on them or baby oil or something underneath it so that it doesn't stick as hard. But when you pull them off, man, that hurts worse than my abdomen, actually. So anyways, good luck to you on your journey. I'll keep posting new things that I find out about myself and about the whole, our whole experience and stuff. And take care of yourself.